What was it like going to school here?
It was pretty rough. It wasn't very easy. I was kind of like an outcast.
Being a transgender kid or teen living anywhere in Canada comes with challenges. But for people in rural areas or small towns like this, it can be especially tough, encountering attitudes that challenge their very existence.
We're allowing them to be chemically castrated and sterilized. This is more than a teaspoon of poop in the cooking batch.
MLA Jennifer Johnson later apologized for that comment made before she was elected. But encountering homophobic and transphobic attitudes isn't unusual. That's why we're in Ponoka in central Alberta, finding out what it's like to be a trans teen fighting for acceptance, especially when you need healthcare.
I came out to a select few people and immediately it was like something clicked.
Crow Hayden Kay was 16 when he told his close friends and family that he was transgender. His family was supportive, especially his mom. She booked him an appointment with their family doctor to ask for a referral to a gender clinic in Edmonton, about 100 kilometers north of Ponoka. But the call with the doctor didn't go well.
He was asking me really weird questions, like what if I wanted to get pregnant someday? What if I had a husband someday? I think he asked me what if you want to keep your boobs? It was so weird and invasive. We just wanted a referral to a gender clinic. Just a referral was all that we wanted, and then it would be out of his hands. He refused to do that for us.
Trans youth say gender-affirming healthcare can be life-saving, but depending on where you live in Canada, it's hard to get, and the wait can be years long. But there are healthcare providers across the country providing this kind of care. They want to make it easier for kids and teens to get it.
So affirming care is sort of a bigger term, but it really means, meeting the kid where they are.
That's what endocrinologist Dr. Daniel Metzger wants to do. Metzger co-authored a new position statement by the Canadian Pediatric Society, endorsing affirming care for transgender and gender-diverse kids and teens.
They have no legal support, but they also have no medical support in some places, or if they had medical support, it's been taken away. So, the unfortunate fact is that the suicide rate amongst trans youth is the highest of all. That goes down very rapidly once a child just talks to one grown-up in charge and says, yeah, we believe you, let's help you out.
Metzger says many kids and teens are only interested in social transition, changing their appearance or their name. Surgery isn't common for adolescents, and certain types are reserved for adults. Hormone replacement therapy can be an option for some youth. Before getting a prescription, they need to be assessed by a mental health care provider and then are often referred to a specialist like Metzger. That process can take years. Delay can mean going through puberty in a gender that you don't identify with, causing significant distress and a need for more intensive medical treatments later in life.
Any family doctor can do gender-affirming care, and I think that's the important thing to take home. What is lacking, however, is the training for family physicians and even specialists. So it's really fear and lack of knowledge. Fear of the unknown, fear of not being taught, fear of doing something wrong. Supporting and
at his gender clinic in Edmonton, Dr. James Makokis sees patients not only from all over Alberta, but from other provinces. Makokis both counsels and diagnoses patients with gender dysphoria and may prescribe hormones.
We have a long waiting list of people who are wanting to access care, with few clinicians who are willing to take over the care once the patient is started on hormones.
Makokis started an informal training program, inviting other physicians to shadow him to learn how to do gender-affirming care themselves.
And that's the hope, is that we have family doctors willing to take over the care and in fact start and initiate treatment within their own practices.
Transgender and non-binary identity issues are becoming increasingly politicized, and misinformation about gender-affirming care is rampant.
It is very alarming. The climate is changing. We've gone from being tolerant to one now that is shifting more towards violent rhetoric.
Kennedy says there are serious access issues when it comes to gender-affirming healthcare, especially in rural communities.
The reality is that politicians need to start looking at the serious consequences of what it means to not provide the care that people need.
Back in Ponoka, a pediatrician Crow Hayden Kay saw for a different health issue diagnosed him with gender dysphoria and referred him to a gender clinic. It took longer than he hoped, but he started taking testosterone shortly before his 18th birthday.
It's like literally been life-changing. It feels so much better, even with all the weird like second puberty stuff. Things are changing for me. It feels really good. And I'm so much happier than I was like in high school.
Hayden Kay is planning to leave Ponoka. He hopes to move to Calgary and attend art school.
I do hope that this place can become more accepting and safer for queer folk who live here.